Exhaled particles are a fingerprint of the epithelial lining fluid. Those particles originate deep in the lung from peripheral airways and alveoli. Those particles are very, very small. They are below 1 micron, about 400 nanometers. When liquid bridges in the periphery of the lung open up, those particles are emitted with every breath. Doctors use this phenomenon when they do auscultation with their patients and search for abnormalities. We at Fraunhofer have developed a technique where we can determine the deposition of exhaled particles with every single breath. This allows to non-invasively determine airway geometry because larger particles sedimentate different from smaller particles, allowing to derive airway size. We can also use these particles and capture them on wafers and then elute those particles to measure cytokines, mRNA or metabolites. The greatest challenge for analysis is the detection limit because the amounts of biomarkers and particles is very, very low. We can also use those eluted particles to measure drug levels of patients that have been given those drugs in order to derive pulmonary pharmacokinetics. In summary, exhaled particles are an intriguing method with broad potential for non-invasive monitoring of the lung.